spiritual care team ought to be a redundancy, that any care team within modern medicine ought to be attending to life in all of its fullness and complexity, and that would include those aspects of life that we consider the spiritual. The fact even that we need the language of spiritual care team within modern medicine is already a suggestion that something is not right within the way that medicine is often practiced, or at least it's experienced by patients and family members. So spiritual care teams are in some ways maybe a kind of corrective to that. I would suggest that all medical care ought to attend to the spiritual, and that all medical care ought to include those with the training and the capacity to do so. When there's specifically religious practices involved, like prayer or the sacraments, there ought to be people who are themselves inhabiting religious traditions and authorized to perform those practices. That would include chaplains. It might also include community clergy or other spiritual leaders. And in that sense, chaplains and clergy need to be working closely with medical care providers to ensure that medical care is done in a way that's sensitive to the whole person, including those aspects of human life that we consider spiritual.